Welcome back. Right now we are joined by Dr. Libin Wang and Gwen Mayes to talk about genetics and heart disease. It's important that with upcoming National Family History Month that we think about how our genetics play a role here and the connections that make so that we can improve our health, improve outcomes. Right now we're so grateful that Dr. Wang and Gwen are here with us today. Dr. Wang, let's start with you. Tell me more about this connection between genetics and heart disease.
Thank you very much. Good morning, everyone. Hypertrophic cardiomyopathy, also known as HCM, is a genetic condition that affects 1 in 200 to 1 in 500 people. It actually is the most commonly inherited heart condition. It is caused by gene mutation that lead to heart muscle thickening, although the heart muscle is very strong, but it doesn't relax well, so that the blood in and out of heart is hindered. This causes inadequate blood flow to the body that leads to shortness of breath, and shortness of breath on exertion. People may feel their heart racing. They may have chest pain. Sometimes they faint, and sometimes they pass out. Most severely, people may die suddenly from it. Because it is genetically inherited, so it is important to raise the awareness of this condition.
And Gwen, tell us about your journey with hypertrophic cardiomyopathy and if you had any family history within this.
Absolutely. All those symptoms that Dr. Wang described, shortness of breath, being fatigued, feeling dizzy, I actually had as a young girl, even on the playground. I had a murmur at birth. So there was a history of sudden cardiac death in my mother's side of the family. But over my teenage years and through college, I kind of kept quiet about it because oftentimes, when you're a rambunctious teenager, people just pass things off as being natural part of living. I was diagnosed around the age of 30, about half my lifetime ago, when I had a sudden event on the metro in Washington, D.C. It was really scary. I had palpitations, felt like a horse kicking the inside of my chest. I was really dizzy. I was clammy. It was the middle of August. Went to an ER, and the next week was diagnosed with hypertrophic cardiomyopathy. So it had a big impact on my life, but I did receive an accurate diagnosis at that time.
And doctor, what do you do if you do get a diagnosis for hypertrophic cardiomyopathy?
Yeah, because this condition does affect people at all age, gender, and race. So it's really important when you have this condition or you are aware a family member have this condition to go to your doctor, health provider to get yourself evaluated, have a good cardiac examination, cardiac study as indicated, and if somebody has been tested genetically positive in the family, pursue genetic testing.
And Gwen, what's your recommendations for individuals who do get diagnosed with HCM?
Well, as Dr. Wang said, if there is an actual diagnosis, it's important to have that conversation. It can be a really sensitive conversation, but you want to have that with other family members and discuss with them whether it's appropriate to get genetic testing. But even more importantly, for those who haven't been diagnosed, then you want to understand that the symptoms you often feel about heart disease, whether you're dizzy or fainty, can represent a lot of different heart conditions. So Dr. Wang and I are here today collaborating with Bristol-Myers Squibb to make sure that people who haven't been diagnosed actually understand what the conditions are and don't just brush them off.
And where can we get more information, Gwen, about HCM, everything we've talked about today with you and with Dr. Wang?
Well, that's a very good question, so thank you for asking. As we mentioned, these symptoms can look like a lot of different things. It can asthma or other heart conditions. So you might want to go to a website, coulditbehcm.com, to learn more about the condition. You can read in there about the symptoms and sort of go through a checklist. You can also print out some questions that you can ask your doctor and possibly suggest a referral to a cardiologist. So that website is coulditbehcm.com. And of course, HCM stands for hypertrophic cardiomyopathy.
Well, thank you so much, Dr. Wang and Gwen Mayes, for joining us today. I really appreciate this important information about genetics, heart disease, and HCM. We'll be back with more right after this.